Question 1. A patient is scheduled for a pericardiectomy. What does the prefix peri - indicate about the location of the procedure? A. Inside the heart. B. On top of the heart. C. Around the heart. D. Under the heart. Answer: C. Around the heart. Question 2. During change of shift, which patient should the nurse assess first? A. A patient with bradycardia who is asymptomatic. B. A patient with tachypnea and low oxygen saturation. C. A patient complaining of fatigue with anemia. D. A patient receiving for antibiotics for cellulitis. Answer: B. A patient with tachypnea and low oxygen saturation. Question 3. A nurse is educating a new CNA about signs of hypoglycemia. What does the prefix hypo - indicate? A. Excessive. B. Equal. C. Below or deficient. D. Above or elevated. Answer: C. Below or deficient. Question 4. Which task is appropriate for a nurse to delegate to a UAP? A. Administering insulin to a diabetic patient. B. Educating a patient about postoperative care. C. Obtaining a routine blood glucose reading. D. Assessing a patient's response to pain medication. Answer: C. Obtaining a routine blood glucose reading. Question 5. What does the prefix tachy - and tachycardia suggest about the patient's condition? A. Irregular rhythm. B. Slow rate. C. Fast rate. D. Normal rhythm. Answer: C. Fast rate. Question 6. A nurse prioritizes a patient diagnosed with hyperkalemia. What does hyper - indicate in this context? A. Absent. B. Normal. C. Low. D. High. Answer: D. High. Question 7. What does the prefix intra - mean in the context of intravenous therapy? A. On top of. B. Between. C. Inside. D. Outside. Answer: C. Inside. Question 8. Which of the following tasks should the RN perform rather than delegate to a licensed practical nurse LPN? A. Reinforcing education on medication. B. Assessing a newly admitted post-op patient. C. Administering oral medication. D. Catheter insertion for a stable patient. Answer: B. Assessing a newly admitted post-op patient. Question 9. A patient is diagnosed with dysphagia. What does the prefix dis - suggest? A. Fast. B. Normal. C. Difficult or abnormal. D. Without. Answer: C. Difficult or abnormal. Question 10. A nurse preparing for a procedure involving subcutaneous injection should understand the prefix sub - means. A. Over. B. Beneath. C. Around. D. Through. Answer: B. Beneath. Question 11. In which of the following situations is it most appropriate for the RN to intervene immediately? A. UAP assisting with feeding a stroke patient with dysphagia. B. LPN reinforcing teaching for a newly diagnosed diabetic patient. C. UAP taking vital signs on a stable patient. D. LPN administering a scheduled medication. Answer: A. UAP assisting with feeding a stroke patient with dysphagia. Question 12. The prefix endo - in endoscopy refers to A. Outside. B. Surrounding. C. Within. D. Under. Answer: C. Within. Question 13. Which patient condition should take priority for immediate intervention? A. A patient with hemiplegia post-stroke. B. A patient reporting chest pain and diaphoresis. C. A patient with a new diagnosis of type 2 diabetes. D. A patient who is not voided for 6 hours. Answer: B. A patient reporting chest pain and diaphoresis. Question 14. The term polyuria includes the prefix poly dash. What does this prefix indicate? A1. B. Excessive. C. None. D. Decreased. Answer. B. Excessive. Question 15. The term preoperative refers to a time. A. During surgery. B. After surgery. C. Before surgery. D. While under anesthesia. Answer. C. Before surgery. Question 16. A nurse should question which delegated task to a UAP? A. Measuring urine output. B. Documenting intake and output. C. Performing a sterile dressing change. D. Transporting a stable patient to radiology. Answer. C. Performing a sterile dressing change. Question 17. What does the prefix contra dash in contraceptive suggest? Out. B. Within. C. Against. D. Beyond. Answer. C. Against. Question 18. The prefix ap dash as an epidermis means A. Above or upon. B. Inside. C. Beneath. D. Around. Answer. A. Above or upon. Question 19. A nurse is caring for a patient with hemiparesis. What does the prefix hemi dash mean? A. Both sides. B. One side. C. Complete. D. Upper half. Answer. B. One side. Question 20. The prefix inter dash in intercostal muscles refers to A. Under. B. Around. C. Inside. D. Between. Answer. D. Between. Question 21. The prefix ISO dash in the term isotonic solution indicates the solution has A. No fluid. B. More solutes. C. Unequal concentration. D. Equal concentration. Answer. D. Equal concentration. Question 22. Which patient would require the nurse's immediate attention? A. A patient receiving isotonic 4 fluids with bounding pulses. B. A patient with moderate pain rating of 6 out of 10. C. A patient requesting assistance with toileting. D. A patient with a resolved fever. Answer. A. A patient receiving isotonic 4 fluids with bounding pulses. Question 23. The prefix of dash in abduction refers to A. Toward. B. Within. C. Away from. D. Across. Answer. C. Away from. Question 24. A nurse is reviewing patient documentation that includes the prefix hemi dash. What does this term imply in patient care? A. Full paralysis. B. Involvement of one side of the body. C. Quadriplegia. D. Bilateral weakness. Answer. B. Involvement of one side of the body. Question 25. The prefix peri dash in perinatal means A. Surrounding birth. B. Before conception. C. After delivery. D. At the moment of fertilization. Answer. A. Surrounding birth. Question 26. The nurse is caring for a patient scheduled for a transdermal patch. The prefix trans dash means A. Below. B. Through. C. On top. D. Inside. Answer. B. Through. Question 27. What does the prefix ecto dash in ectopic pregnancy suggest about the implantation? A. Normal location. B. External or outside normal location. C. Near the uterus. D. Within the uterine lining. Answer. B. External or outside normal location. Question 28. The nurse should avoid delegating which of the following to a UAP? A. Bathing a patient with dementia. B. Recording fluid intake. C. Assisting a patient with ambulation. D. Monitoring for signs of respiratory distress. Answer: D. Monitoring for signs of respiratory distress. Question 29. The prefix dash in apnea means A. Double, B. Without, C. Increased, D. Shortened. Answer: B. Without. Question 30. What does the prefix macro dash indicate in macrocephaly? A. Decreased size, B. Normal size, C. Large size, D. Fluid filled. Answer: C. Large size. Question 31. The nurse is reviewing a report with the term antipyretic. The prefix anti-dash means A. Supportive, B. Causing fever, C. Against, D. Beneath. Answer: C. Against. Question 32. The patient with anuria is at risk for which complication? A. Hypovolemia, B. Dehydration, C. Electrolyte imbalance, D. Diarrhea. Answer: C. Electrolyte imbalance. Question 33. The prefix auto dash in autoimmune disorder refers to the body. A. Attacking its own tissues, B. Receiving donated cells, C. Being immune to pathogens, D. Producing antibodies extrally. Answer: A. Attacking its own tissues. Question 34. What does the prefix neo dash in neoplasm mean? A. Scarred, B. New, C. Slow, D. Cancerous. Answer: B. New. Question 35. Which patient is at greatest risk based on their diagnosis? A. A patient with neoplasm and unintentional weight loss, B. A patient scheduled for routine dental cleaning, C. A patient recovering from a resolved UTI, D. A patient with a mild tension headache. Answer: A. A patient with neoplasm and unintentional weight loss. Question 36. The prefix retro dash in retroperitoneal suggests location. A. Inside the abdomen, B. Behind the peritoneum, C. In the urinary tract, D. Beneath the skin. Answer: B. Behind the peritoneum. Question 37. What does the prefix mono dash in monocyte indicate? A. Multiple, B. Few, C. One, D. Normal. Answer: C. One. Question 38. A nurse should prioritize care for a patient with hypovolemia due to what risk? A. Decreased cardiac output, B. Excess oxygenation, C. Low glucose levels, D. Hypertension. Answer: A. Decreased cardiac output. Question 39. The prefix by dash in bipolar disorder refers to A. 2, B. Normal, C. Rapid, D. Balanced. Answer: 2. Question 40. A patient with a diagnosis including the prefix multi-dash likely has A. One organ involved, B. Multiple systems affected, C. An unknown condition, D. Normal lab values. Answer: B. Multiple systems affected. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.